Hi, everyone. This is Dawson Esslinger, and this is my updated 2025 version of my previous video, which goes into great detail about the GCU ABSN nursing program, which I just graduated from. Now that I have a job and I'm starting, wanted to give you guys an overview of everything now that I have finished and completed it all. So here it is. So before I get into this, for some reason I only have 15 minutes to record this, so we're going to try and make this fast. But if you have any questions, put them down in the comments. I answer them as fast as possible. And I have a bunch of other videos going into study methods, questions, and whatnot. But all that aside, overview of this program, it's 16 months long. You have 4 semesters straight. It's different from a normal program because you don't have a summer break. Each semester is 15 weeks or so. You have around a 2-week break between the semesters, and the cost for the entire program is about $60K before living expenses. And there's a bunch of different locations you can take this program at. So to get into this program, these classes listed here are the ones that you need to have to apply. These are the criteria right here for your GPA, and they have to be pretty frequently taken, or taken recently, I mean. These classes, plus some others, are what you need to have, because you need to have a total of 60 credits to apply to the ABSN program. So these are included. These aren't 60 credits by themselves, but they contribute a lot to the 60 credits. So keep that in mind, do the math, contact a counselor, and they'll go over everything with you. Also, before you apply to this program or get accepted, you have to take a HESI A2 exam, which is just an entrance exam. There's a lot of good resources online to study for that. It's pretty simple. Then you get a background check through GCU, and if you're in Arizona, you have to get a fingerprint clearance card, which you'll get instructions on by your counselor. And then with your living expenses aren't included in this total here, but this comes from my own budget book. So these are very, very accurate figures. My total cost was 53 grand. This did not include my living expenses, and so I had to spend a lot more than that. But yeah, keep this in mind as you budget things out, get planned. I had to take out some pretty large loans. So if you can manage working, go for it. I really don't recommend it because this program is very difficult, just like with any nursing program, to be fair. And then you have your locations here. I went to the Sun City location in Arizona. Great program. If you go there, or if you can go there, I highly recommend it. The Phoenix program is on main campus, and then all of these other programs here, I have heard some stuff about. It should be good for pretty much all of them. I know Albuquerque and Orlando are pretty new programs, so I'd just be a little bit wary of those unless you cannot go to any other place. But you have a bunch of different options to choose from. All right. Here's your first semester. We call semesters levels here. So this is level 1. You have nursing foundations, intro to professional nursing, health assessment, and pharmacology. We'll go into these programs in a second. I said programs, I really meant classes, but yeah. So we have numbers for each of our classes. I'll refer to them as the numbers. So this is 300. This has a lecture, also known as a didactic portion of the class. But these are not in person, which is amazing because it saves a whole bunch of time. They're recorded lectures that you get access to via a YouTube link on something called ConHCP. You'll learn what that means later. It's just a link to a website. But you have a lecture portion with labs, exams, 2 sim labs, 1 lab a week, I think. And you have a pretty basic rotation in clinical setting for about 5 weeks, 1 day a week. You also have a PBA, professional-based assessment, and that one's not really difficult, but you're going to have those pretty frequently, like one per class per semester. This class is really just getting you introduced to nursing, nursing fundamentals, body systems, and just other general information. This class is 310. It's a bit different because the focus here is nursing history. So if you ever heard of Nightingale, you're going to hear her name a lot. You're going to memorize a lot of names, a lot of laws, and stuff like that. This one, you only have like a lecture portion with exams. It's not really difficult. Just expect to memorize a lot of stuff. Flashcards will be very helpful. This is Health Assessment 316. A lot of people find this challenging for some reason. I thought it was pretty simple, and I enjoyed it a lot. You have a lecture portion with exams, and then you have one lab a week, and then you have a skills assessment at the end of the semester, where you go over the entire body from head to toe. It's called the head to toe assessment. So this class, you just learn how to perform an assessment of a patient, but you're assessing normal findings, because this is setting up the foundation so you know what's normal. So in future semesters, you can identify what is abnormal with your patient. So this is just establishing that baseline foundation of what is normal with your patient. Pretty simple class. Otherwise, I found it interesting compared to the others. All right, this class is pharmacology. Forgot to write the number, but it is 318. This class, you only have a lecture portion with exams, but I really didn't like this class just because I'm not good at drugs, memorizing drugs, knowing everything about them, which you have to do for this class. You have probably 100+ drugs that you need to memorize with all the info about it. What do they do? What are their side effects, contraindications? How do you administer it? Yada, yada, yada. But the only reason I passed and how I'd recommend for you to do it is to use drug cards and study groups. Quiz each other in a study group setting using flashcards with all the info on it. This class is hard, but it is not impossible, is what I'll say. All right, level 2. Quick note, most people fail out of nursing school. If they fail out of nursing school, most of them do that in the first semester. So we lost around 40% of our starting group over the entire duration of the program. And I'd say roughly like 35% of them we lost in semester 1. So if you've made it to semester 2, great. You've made it farther than a lot of people. But anyways, in this semester, you're going to have adult health nursing 2, or 1, I mean, excuse me. This is med surg. You have psych, known as behavioral health, and then you have a research class. In adult health nursing 1, also known as 320 or med surg, you have lecture and exams. You have 5 sim labs. You have normal labs most weeks, and you have a clinical rotation on a med surg unit. I think it's 5 weeks or something. But this is where you start to feel like things are coming together, and it's really nice. You also have a PBA, and this is where you administer medication to a mock patient. Have to do it correctly, and if you fail it 3 times in a row, you fail the class. That rarely happens, but it takes a lot of practice, so you have to go to practice lab a lot. This class focuses on chronic illnesses and your interventions as a nurse, or what you do as a nurse for those cases. So pretty straightforward, very interesting class. And moving on, this is 322 Psych, a little psychiatric class. This one has exams, lectures, just like all the others, or most of the others. You have 2 sim labs and 2 clinical shifts. These are done at an inpatient psych unit. So for me, I was at a psych ward in downtown Phoenix. It can be a little bit frightening if you're uncomfortable around that stuff. Frankly, I love to get down in the nitty gritty. But yeah, you're just focusing on, with this class, you're focusing on psychiatric nursing with an emphasis on patient safety. The exams in this class can throw a lot of people for a loop because it's very different. But if you keep in mind that your primary focus is on patient safety as well as your own safety, then you'll be just fine. Just keep that in mind when you answer those questions. And then this is your last class for semester 2. This is 324. This is your research class. You have no exams in this, but you're going to write a lot of papers and you're going to do a lot of research. This sets you up as a foundation for the rest of your semesters. because you pick a niche topic, you do a bunch of research on it, and then you're going to build upon that in later semester research classes. So not a hard class, just a lot of writing. All right, here in semester 3, you have adult health nursing 2. You have childbearing family, which is OB, and child rearing family, which is pediatrics. You also have a leadership, ethics, and healthcare class. That's a more research and stuff about delegation, ethics, and all that. Here in 430, which we call critical care, you have a lecture portion with exams. You have 2 sim labs. You have normal labs, not as often as before. And then you have a clinical rotation and a critical care unit. I got put on a PCU unit, but most people get put in the ER or ICU. I just got the short end of the stick. You also have another med admin PBA. And the difference between this and med surg is the focus here is on acute illnesses, along with those treatments, interventions, and what you do as a nurse. This class is OB, obstetrics. It's a 7-week class, so you'll take this at like either the beginning of the semester or the end, and then the other half will be taken up by peds, which is also a 7-week class. You have labs every so often. You have 2 clinical shifts, 2 sim labs, and a PBA. And then, your focus here is just focusing on caring for the pregnant mother, but you also have a second patient, which is the fetus or the newborn. So you're going to focus a lot about, reading fetal heart tones, stuff like that, specific medications for pregnant mothers, and all that jazz. This class is pediatrics. Like I said before, it's that 7-week class that goes hand in hand with OB. So, like, OB will be first and then peds, or vice versa throughout the semester. It makes more sense when you're in it. Same setup as OB, labs every couple weeks. You have 2 clinical shifts, 2 sim labs, and a PBA. I really enjoyed this class. I found it quite easy. But you're focusing on care of pediatric patients and unique stuff for pediatric patients compared to adult patients. So a lot of stuff is like cardiac, GI, specific illnesses, specific cancers, and all that. Then your last class for semester 3 is continuing on with your research that you did before. This is your research class, no exams. So you're doing more writing, but you're also adding in a bunch of legal and ethical matters. So this gets wrapped up into your research and writing that you'll be still building upon for later. And now we're in our last semester. This is Pop Health. You have transition to practice and your final research class. Here in Pop Health or 440, you have lecture, exams, 2 sim labs, and then 5 shifts in a community health setting. I did this at like a Catholic-run homeless shelter. Really cool, really interesting experience. I got a Narcan, a bunch of people. Very shocking to other people that were there with me, or like, being a nursing student there. But yeah, there's also like 5 normal labs, but they're done from your computer, so it's a little unique. The material here is a little confusing and a little abstract, but it's simple, straightforward class. I didn't entirely enjoy it though. Here's transition to practice, 444. You have a lecture and exams for this. You have a PBA, sim lab, and then 8 or so shifts on a unit that you apply for in semester 3. The material I wrote down there, but the exams in this class are hard for no good reason. It's very confusing, but that's the way it goes. I nearly failed this, funny enough. And then your last class is your capstone. This is where you write a massive research paper combining everything else that you've done so far. You're going to spend a lot of time on this, but otherwise it's really simple. No exams, no nothing like that. You're going to dump a lot of time into it. And so that's the nursing program in a nutshell, but running low on time here. If you need info on study methods, random questions, info on the NCLEX or jobs, I have other videos on that, or write down in the comments and I respond as fast as I can. Thanks, everyone. I'll see you later.